I started to get migraines back in my mid-20s. I'm currently 37 years of age now. And back in my 20s, my migraines were extremely excruciating. I wasn't able to focus. I was missing work a lot. My motivation levels were very low. I remember being very tired, sleeping all the time. And it was just a very, very bad experience for me. I decided to see a family physician in my mid-20s, and I explained to him what I was experiencing and the pain that I was experiencing through my migraines. And basically what he did was he gave me painkillers, and it helped, but I noticed that it was just masking the problem because the pain would go away and then the next day it would come back again, so it wasn't giving me any relief, and I was taking more and more painkillers. There were several occasions where I was hospitalized where they had to administer morphine injections in me, and within 24 hours the pain came back with the same intensity, and it came back completely full-blown. It was just excruciating. I was then referred to see a neurologist, and I explained to him my circumstances again, and the neurologist put me on different medications. Some that I remember were nortriptyline, Zomig, Maxalt, Relpax, all kinds of medications. It wasn't giving me any relief at the time, so I went back to speak to the neurologist, and what he did was he increased the medication dosage, and again it wasn't helping me at all. I decided to see a chiropractor within a year, and again I wasn't getting any relief from the chiropractor, and what I noticed that I was already in my early 30s after seeing all these healthcare professionals, so at this point I gave up and I went back to see my family physician, and what he decided to do was put me back on painkillers, and he decided to put me on antidepressants, birth control pills, other types of painkillers, and again it wasn't giving me any relief. The pain was still there, but what I noticed was I was starting to get mood disturbances. My temper was very bad, my motivation levels were low, I was very tired, I couldn't sleep. It was just a very, very bad experience for me. One day my husband met Dr. Sudar and spoke to him about my situation. Dr. Sudar sat down with my husband and I and explained to us the connection with the TMJ joint, with migraines, neck pain, as well as headaches. Dr. Sudar completed a thorough evaluation and imaging, and he did find that I had a TMJ disorder, and that was causing all my migraines, my neck pain, as well as my headaches. And at that point I decided to start treatment back in March of 2013, and shortly after a month I remember my migraines completely stopped. I was sleeping better. I wasn't tired anymore. I was feeling my energy levels were higher. I felt happier. I used to sleep on my lunch break at work, and now I'm able to utilize that time to go to the gym every day. I thought I was going to live the rest of my life taking medication and jumping from one doctor to the next until I started this treatment. And I'm very happy I did, because I thought I was going downhill until now. And I just wanted to say thank you, Dr. Sudar, for saving my life.